Hello, this is Julia, and we'll be talking about a second case study on Margaret. So Margaret is a 32-year-old woman who for the past year has been showing signs of having anxiety and panic attacks. Noteworthy facts about her is that she read online books about anxiety. She read self-help books. She calls herself stupid. She realized pain in the chest isn't actually a heart attack whenever she feels the panic attack coming. And she uses self-talk successfully. First, we'll look at her feelings, physical symptoms, and behavior. Then we'll look at the possible diagnosis, followed by the risk factors, and we'll close with the treatments. So her feelings include embarrassment, nervousness, panicky, dread, as well as feeling of anxiousness. Her physical symptoms are racing heart, bursting into tears, breathlessness, and chest pains. Her behavior are gripping the trolley strongly, leaving the store with food still inside, a general urge to flee, in which she actually leaves the store, and avoiding the store altogether. Her possible diagnosis includes specific phobia or social anxiety disorder. To figure out which one she suffers from, we'll look at characteristics of each of these disorders and which one she has. So the specific phobia has fear of situation that is out of proportion of any real threat. She has an avoidance behavior. She's aware that her fear is excessive and it doesn't actually make sense. And the symptoms have lasted more than 6 months, in which her case it's lasted a year. Her social anxiety disorder symptoms are more extensive and intensive than shyness. There's a fear of negative evaluation or scrutiny by the people around her. Exposure to trigger leads to anxiety about being humiliated or embarrassed. When she described her situation, she said that she felt embarrassed at how she was anxious and even describing it to the therapist. There's also a 33% chance that she can be diagnosed with avoidance personality disorder because she describes herself as shy. Also, the social situation almost always provokes fear or anxiety. So every time she goes to the store, she feels that anxiety coming. The trigger situation is either dealt with intense anxiety or she avoids going to the store altogether. The fear and anxiety is out of proportion for the threat in the social situation or the cultural context, it seems, because it's only going to the store. But we'd have to discuss with the client more to figure this out. Now we will look at the etological questions. First of all, comorbidity states that 75% of those with anxiety disorder meet criteria for other psychological disorder. So we would need to ask our client about substance abuse, depression, medical disorder, or if it runs in the family. I will talk about this more in the risk factors. And also looking at gender and social factors, it seems that because she's a woman, she is twice as likely to have anxiety disorders, sorry. She's more likely to report symptoms. She will show more biological stress reactivity than men, and certain cultural factors could be the cause. Now looking at, also there's a possibility that she had direct experience where she was scarred or had a negative experience in the store, or through modeling, which is seeing other person harmed in the stimulus. Now we'll look at the risk factors, or temperament and traits. So possibilities are genetics, neurobiological, personality, neuroticism. Genetics, she could have relatives who've had phobias, and so passed it on to her, or other anxiety disorders. Neurobiologicals, there's fear circuit overactivation. Personality, she sees herself in a negative light. And neuroticism reacts with negative affect, calling herself stupid, or maybe she's depressed. We don't know, but talking to the client and getting to know more would answer these questions. There's also the possibility, the Mohrer's two-factor model, which states that conditioned response to threat causes it to continue, which is classical conditioning, or the behavior sustained by avoidance or safety behavior, in which she won't address what actually scares her, and thus the anxiety will not go away. Possible treatments include exposure, in which the therapist encouraged her to go to the supermarket where the last occurrence happened each day. That's also systematic desensitization. Relaxation and deep breathing. Focus on breathing in positive self-talk whenever she feels anxious. Self-guide treatments, in which she's recommended by the therapist to read or to continue searching on. And also to keep a record book. Which are all behavioral techniques that she can use. The cognitive techniques include increasing belief and ability to cope with anxiety trigger, and challenging the expectations about negative outcomes by maybe writing them down, which requires her to think about it first. So that is all we've looked at for Margaret. And it seemed that she either has specific phobia or social anxiety disorder. Thank you for watching.